Hi, I'm Dr. Jennifer Mullendore, the Interim Health Director at Buncombe County Health and Human Services.
What do I do if I feel sick?
So if you feel sick, specifically if you have fever and cough, the most important thing is stay home and call your doctor. This is really important for people who are at high risk of problems with COVID-19. So people who are over the age of 65, people who have significant lung disease like moderate or severe asthma, people who have heart disease, people who are diabetic, especially those whose diabetes isn't well controlled, or any other significant chronic medical problem, including a weakened immune system. I would also encourage pregnant women to reach out to their provider.
When is testing for COVID-19 important? Is it still necessary?
So guidance has recently changed, and testing for COVID-19 is not indicated or required in people who have mild illness. So again, people with fever and cough. However, testing might be appropriate for people who are more seriously ill, people who are hospitalized, those who live in congregate settings like long-term care facilities, nursing homes, jails, homeless shelters. And again, so people should reach out to their provider to see if testing is indicated.
How long can this virus live on surfaces?
So a study published in the New England Journal of Medicine earlier this month found that the virus that causes COVID-19 can live for up to 24 hours on cardboard and up to 2 to 3 days on plastic and stainless steel.
What over-the-counter medicines help if you develop COVID-19 symptoms? Do antibiotics help?
No, antibiotics are not used to treat COVID-19. Antibiotics are used for typically bacterial infections. COVID-19 is a virus, and therefore treatment should be symptomatic. So if you have a fever, using a fever-reducing medication like acetaminophen, more commonly known as Tylenol, or ibuprofen, something like Advil. There are cough medicines available, but science doesn't really show that many of them are effective. So I would stick to the fever-reducing medications.
When should I call 911?
911 is for emergency situations only. So if you are having difficulty breathing, very short of breath, if an individual is blue around the mouth, or has confusion, altered mental status, something that's very concerning and out of the ordinary, that would be a reason to call 911.
When can I stop self-isolating if I am or was sick?
So isolation can end once people meet 3 criteria. So the first is it has to be 7 days since the start of your symptoms. Number 2, it has to be at least 72 hours since you last had a fever without the use of a medication to reduce fever. And 3, your other symptoms have to be improving. So if you had a cough, your cough has to have been improved. Once all 3 of those criteria are met, a person can leave isolation.